Guys, welcome back to Medical Coding with Blue. Today's episode is all about how to study the 2024 ICD-10-CM coding guidelines. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so the coding guidelines, the ICD-10-CM specifically, those coding guidelines. Now, a lot of people get very overwhelmed by the guidelines because if you are reading them from the book, if you have the Optum ICD-10-CM Expert for Physicians, it is 32 pages, but it is front and back, and it is double columned all the way through. So it is a lot, quite a bit of reading. If you download the one from the CMS website, it is 120 something pages, 122 I think, or maybe 118, I'm not sure. I haven't looked at it in a while. But the one on there is free. It is the current edition. So if you are practicing with older books, maybe you have the 2022 books right now, and you're just sort of waiting and saving money to get the new books, and you're using your old coding books, you can certainly go online and get the CMS ICD-10-CM, the latest coding guidelines. They do have the 2024 guidelines up. So just so you know that is a free resource out there. But a lot of people get overwhelmed with these guidelines, like I said. And the reason that they get overwhelmed is because it looks like it's a lot of information. It is. It is a lot of information. The guidelines cover everything that you need to know about the language of the book. What does and mean? What does with mean? It goes over that. It goes over the punctuations as well, the parentheses, the brackets, and all this other good stuff. And then it goes through every single chapter and talks about chapter-specific rules for coding. So if you are coding for cardiology or if you're coding for orthopedics, there are specific things that it's going to go over specifically in the coding guidelines. I was asked by somebody, do you have to look in the coding guidelines and then look up the code and then see if there's anything in the guidelines about it? This is the beauty of reading the coding guidelines in their entirety once per week while you are studying for medical billing and coding. I do recommend this, to take the time to read parts of the coding guidelines until you complete all of the guidelines every week that you are in school. The thing that it will do is speed you up on your reading speed, which a lot of people suffer with reading speed. And they don't want to read, and they're like, do we have to do all this reading? That's 90% of what medical coders do in a day is read. Reading and reading comprehension are very key. And so you want to make sure that you're practicing, and what better way to practice than with the coding guidelines. So taking the time to break it down, it is 32 pages. Like I said, it's all double columned. You can take sections at a time, just a few pages per day if you need to. If it takes you 2 weeks to read the coding guidelines in their entirety, the first few go arounds, that's okay too, because you're building up that speed. You know, runners, they don't start off at marathon speed right away, do they? No, they have to take time and build that skill, build their speed, condition their bodies. It is the same way that we as medical coders have to do when we're learning the coding guidelines. Now, a lot of people will say, well, Blue, I just don't understand the wording. The wording doesn't make sense. Yes, there are some phrases in here. There's some sections that it's really kind of confusing, especially if you have no background. But fear not, my friends, fear not, because when you are looking at those sentences, after a while, it will make sense. But know this, it is not going to make sense to you right away. And if you ask, well, why can't they just make it into easy to understand? No one will make things easy for you to understand, because again, we as medical coders have to know what doctors know while never having gone to medical school. Doctors don't ask to have things put into very simple terms when they're in medical school, do they? It is the same thing that we as medical coders have to have, that mind frame of we have to read and understand this advanced documentation. It is not impossible, so don't start panicking yet. If you say, well, I don't have any medical background and I didn't know it was going to be this hard. Anything worth doing that is difficult, it will reap lots of rewards if you commit to it. There's a big problem nowadays about people committing to things. If it's not flashy, if it doesn't get them where they want to right away, if it's taking too long to learn, they just lose interest in it. And unfortunately, having a shortened attention span is a big part of that. But we have to go against having a shortened attention span. We as a society need to start building up our attention spans to be longer. That's why I always do long form videos, because I refuse to do anything short form anymore, because when I did 8-minute videos, people had even more questions. And I am not one of those ones that's going to skip detail. I'm a very detail-oriented person. So with that said, you want to make sure that you are conditioning yourself and your brain to take in this information and learn to be patient with yourself and your learning ability. Because what happens is when you are sitting here trying to say, okay, well, I don't get this. And immediately your brain is going to be like, okay, we don't get it. We don't understand this. Then you're going to start resisting reading the coding guidelines. Well, the coding guidelines is not important. Let me just go ahead and just look up the codes. Meanwhile, there's something in the guidelines that's telling you something about sequencing, whether or not that particular code is going to apply in this situation. Maybe you need to apply another code in a different kind of situation. So again, that's why I say it all goes back to reading your coding guidelines. And so many people lately have told me, well, Blue, I'm about to go in and sit for my exam, but I don't understand the coding guidelines. Then why are you going to sit for an exam? Why are you going to go sit for an exam when you don't understand it and it's so confusing to you? And I told you guys, I don't like that word. I don't like that word confused, because you're not confused. You're just not spending enough time with it. There's a difference between the two, because if you're confused, you're going to know exactly what is bothering you. And if you know exactly what is bothering you, the first thing you need to do is go into Google, type it into Google. How do I do this? Or how do I code for that? Or what is the process for this? Then that's when you can start learning. Okay, guys, people don't want to do their research, and that's what happens. You feel like you're confused, and you're actually not confused. You just need to do more research, and you need to do more studying. And it starts by reading the coding guidelines in their entirety. And you have to push through that feeling of, I don't understand this, so I want to give it up. It's going to take some time to understand. I have said this many times when you're studying the coding guidelines. You will not understand it in its entirety the first few months that you're going through it. Even the first year, you're still not going to understand it, because it's very, very dense. It's very densely written, and it's very difficult sometimes to get, especially if you are already getting frustrated with yourself and learning, okay? So the best way to start learning the coding guidelines is to first put yourself with the guidelines, whether that is to read them straight from the book or to listen to them. I've already explained before how to listen to them. I'm not explaining it again. But take a few pages and read those. And however much you can read in 30 minutes, just take a Saturday or something and start reading. And put the timer on, stop the timer after 30 minutes, take a break, and then come back to it. And you may be surprised that maybe the first few times you're not going to get through that many pages. It's okay. Keep pushing through that. Do not give up, and do not say, oh, well, no, I can't learn this. Yes, you can. There's plenty of ways to get more practice with coding, right? But when it comes to these guidelines, you have to have that base foundation of those guidelines. And the reason that you have to have that is because when you are coding, it's going to start coming back to you. Your brain is going to be like, wait a second, we read something about this. And then you're going to be like, okay, let me look in that chapter specific guidelines again. So if I'm getting a code, and I'm not really sure that this code is going to apply because I don't really feel that confident in it, let me make sure there's nothing in the guidelines specifically about that. So you're going to turn to that specific chapter in the guidelines. Because the guidelines, it starts out with part A, right? Which is your conventions for ICD-10-CM. And that's going to talk about the format and the structure. It's going to give you the breakdown of the terminology as well, as far as like other, unspecified, what do these things mean? And then the 7th digit characters, the placeholder characters, the abbreviations and what do they mean. Everything is right there. Not elsewhere classified, not otherwise specified. All of these things are right here in the very first part of the guidelines in section A. And so it's going to explain everything to you. And sometimes it's not going to make sense. But don't get hung up on the fact that it doesn't make sense. Just put a pin in that and then keep going. And then when you keep cycling through it, after a while, it will make sense. All right. So if you're going through section A, it's going to go through all of those. It's going to explain and with and see also code, default codes. It's going to go through all of those things. Part B is the general coding guidelines, and it's going to talk about locating a ICD-10-CM code. It's going to talk about the level of detail in coding, code or codes from A00.0 through T88.9, Z00 to Z99.8, and then U00 to U85. It's going to talk about all of those things in detail as far as things that you need to know. Signs and symptoms, is going to talk about that as well. Conditions that are integral to the disease process. So that means integral means it's a part of the disease process. Some of these words, you may have to look them up in the dictionary. There's no harm in that. There's no shame in having to look up words like that, because that's not a part of your regular everyday speak. And that's something that you're going to have to get past. If you are feeling like, oh, well, I'm too ashamed to look it up, or I don't feel smart enough. I hear that all the time, guys. And really, this is something that's very advanced. And then the fact that in this country, we are able to learn this and get a certification with just having only a high school diploma or a GED, and being given this incredible amount of responsibility as far as with the billing and coding and the selecting the correct codes so that it can be billed and things like that is really incredible. There's other countries where you have to have advanced degrees in order to be a coder. So that we should think that we're lucky because that is something that in this country, you can basically do whatever you want to do when it comes to this career field. You can go as high as you want to. And it all starts with just having a high school diploma or a GED. So again, this is part of the process. Studying, being a very studious person, and reading is very, very much a big part of learning medical billing and coding. And if you are willing to do that, then you are on your way to a career that you may end up loving, okay? Everybody treats this career field very differently. And if you're looking at it like reading these coding guidelines is a chore, it's a pain, then that's exactly how you're going to feel every time you look at them. Instead of looking at the guidelines as, this is my guide. This is my guide because these are the rules. And these rules are very straightforward, even though some of the words are a little hinky. You're still able to work with it. You still know where to go. And for some people, that organization is so awesome to them because these are the specific rules. You don't deviate from these rules and everything's all right, But again, you have to spend the time reading them. Reading the coding guidelines once is not going to be good enough, okay? You have to continuously read them, all right? So continuing on with section B and what it covers, multiple coding for a single condition. There's sometimes when it's not just one code that's going to apply to a condition. It's going to be quite a few codes, okay? And so that is going to go over here. It's going to talk about that. And it's going to put that seed in your mind like, okay, this is when I'm looking at a code, these are the things that I need to look out for, all right? So that's a very good section to go over. Acute and chronic conditions, combination codes. I've talked about this a few weeks ago when I talked about the things that I struggled with learning in the beginning as a medical coder, which was the combination codes. Like, how do you know what is a combination code? And then I learned chronic kidney disease and hypertension, those are always going to go together. So because those always go together, I learned to keep an eye out for those. But that's something that you learn from reading in the book. if you're not reading the coding guidelines and if you're not paying attention to those helpful notes that are in your coding manuals, then you're going to miss out on knowing when those combination codes apply, because it even tells you in those sections. It'll give you those helpful hints, but you'll also get it from the coding guidelines, because not all publishers make their books the same. For me, this is not an ad for Optum, even though I always say that, but it is not. They don't pay me. They know I'm a big fan, because when I did go to conference in Baltimore last year, I did run up to them and tell them what a huge fan I am. But it's because they have such great quality books. I love their books, okay? So that's why I always recommend them, because when it comes to coders having the right tools, it does matter what books you do have. Some people like the AAPC books. Sometimes I think it's because that's all that they know. For me, I am a book connoisseur. You see this back here. I am not afraid of looking at different brands of books. But when it comes to the ICD-10-CM coding manual, oh, there is nobody, the one from Optum, there's nobody that beats them that I have seen. Okay, so with that said, moving right along. So again, it talks about sequela, like late effects, impending or threatened conditions, reporting the same diagnosis code more than once. It answers this question, because believe it or not, this has even come up in my career. I knew better, but I actually had to work with this particular guidance in order to talk to my auditor. So something that you all should know. Laterality, documentation by clinicians other than the patient's provider. Sometimes they'll say, like, that's always drilled in our head, right? Well, what can we pick up from other people that are not the patient's, like, provider, right? We're talking about, like, body mass index, BMI. We can get that from the nurse. We can't always pick up documentation from the nurse. But in this instance, with the BMI, yes, we can. Okay, so that's something that you all should know. For if they have, what is it, their BAC, the blood alcohol content, blood alcohol level. Those we can pick up from, like, the ambulance drivers, right? The paramedics that are taking care of that patient, and they note it down. Well, we can pick that up. So that's something that you all should know. And again, it's in the guidelines. And knowing that, even breaking it down by section is going to help you to better understand what you're coding for and who you can get this information from, okay? Syndromes, and then it talks about documentation of complications of care, borderline diagnosis, use of signs and symptoms, and unspecified codes. We always want to be as specified as we possibly can, because unspecified coding can trigger audits from the insurance. I'm just saying. So always want to make sure that you are very clear on that. External cause coding is all there. The sequencing, the use of the Z codes. The Z codes is like the common, most biggest complaint from students, is because they don't understand when those should apply. Reading the guidelines, you would know when they would apply. Okay. And then we have the C section, right, which is the chapter specific coding guidelines. So here in section C is where it's going to break down every single chapter, and it's going to talk about chapter specific rules. All right, and it's going to talk about that in very good detail. Okay, so it starts off with chapter 1, certain infectious and parasitic diseases, and it's going to give you the code ranges, right? And then it's going to talk about, it's going to break it down. Okay, everything that you need to know about that section of coding. And then infectious agents as the cause of diseases classified to other chapters, and then infections resistant to antibiotics. So that's another one too, right? And it talks about sepsis coding. It is all there. There should be no reason that people are confused by sepsis with all of these guidelines here in the guidelines, right? And then we have, and then it goes on, it talks about everything that you need to know there. Chapter 2 is a neoplasm chapter. It's going to go over everything that you need to know. And if something is a condition of their treatment and when to pick that up and what the sequencing is like, or did the patient have this before they got sick, this is all covered here, okay? Then we have Chapter 3, and then it says reserved for future guideline expansion. So there's nothing really on that, but Chapter 4, the endocrine, nutritional, and metabolic diseases, it covers all of that. So again, reading it, going over, and it'll tell you about all the things. Secondary diabetes, if that's the condition that's documented, what you should know is also there in that chapter. Chapter 5 is behavioral health, everything about behavioral health that you need to know. Chapter 6 is the nervous system, diseases of the nervous system. So when the patient has strokes, right, you want to make sure that you're looking at this section here as well. And it talks about pain too. And what does pain mean as far as when they're documenting it, and what does it look like, all right? And then Chapter 7 is diseases of the eye and adnexa. Everything you need to know about glaucoma is all there. Chapter 8, that doesn't have anything in it, which is the diseases of the ear and mastoid process, reserved for future guideline expansion. And sometimes there are some chapters that are like that because they don't have anything specific to that chapter. And then we have Chapter 9, which is the circulatory system, talks about hypertension in this chapter, and all the things that go along with it. Arteriosclerosis, intraoperative and postoperative, cerebrovascular accident. That's very important to know and understand when. Let's see. And number 10, Chapter 10 is the diseases of the respiratory system. If you work in the pulmonary clinic, this should be your first stop. Anytime you are in a specific clinic addressing a specific specialty, that's your first stop in the guidelines, all right? If you are out, coding already. But always read all of them. Chapter 11 is another one that's reserved for future guideline expansion, and that's the diseases of the digestive system. And then we have Chapter 12, which is the skin and subcutaneous tissue, everything that you need to know about the skin ulcers. Chapter 13 is my favorite, the diseases of the musculoskeletal and connective tissue. It's going to break down everything that you need to know there. That's on the organic conditions, not the injuries, because that's going to come up here. Chapter 14 is the genitourinary system. 15 is for mother-baby. Well, the pregnancies, childbirth, and the porphyrium is covered. And then we've got Chapter 16, conditions originating in the perinatal period. Everything you need to know about babies is all there. Chapter 17 is congenital malformations and conditions. That's covered. It's kind of short, but it is covered. What you need to know about that. Chapter 18 is signs and symptoms, right? That's the signs and symptoms chapter. Chapter 19 is the injuries. So if you're struggling with injuries, this is where you've got to be looking, okay? Iatrogenic injuries, that's something that you need to understand. And it's quite big because there's a lot going on there. I got to speed it up because I'm almost out of time. But Chapter 20 is the external causes, another one of my favorites. And then it goes into that quite a bit as well. It's pretty big, that section. Chapter 21 is for the Z codes. It's going to talk about all the Z codes and when, the screening, the observations, the aftercare, the follow-up, the counseling. So these are all things that you should know where to find them, okay? And then we have Chapter 22. Did I skip over? Okay. Chapter 22 talks about like the codes for special purposes. It really doesn't say too much there, but it is there. And then it talks about Section 2 of Section C. Section 2 is selection of principal diagnosis. And that's talking about like that inpatient side. Section 3 is reporting additional diagnosis. Section 4 is diagnostic, coding, and reporting guidelines for outpatient services. So that's all outpatient stuff. And then we have the Appendix 1 is for present on admission guidelines. Again, that's for that inpatient coding. And then that is it. So if you are not studying for that inpatient side, you can certainly skip over the Appendix 1, okay? You can skip over that. But you want to read all of these sections. And again, if you need to break it down, that's what you need to do. But take the time to review these guidelines, because it's going to make you a better coder. It's going to make you a sharper coder. And even though you're new, there's not going to be anybody that can really go against if you have something that you can show and prove why you coded something from the guidelines, right? There was something in there about like the sequencing or selecting this code, or because we use this, that's why we use this code. Understanding that is your key to going very far in this field, because understanding those guidelines is the very first step. That's just my advice anyway. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.